iStock Audio. iStock Audio.
You are in the patient services area of our program, and we are the undergrad clinic. We take care of patients that come to see the 3rd and 4th year dental students. We also offer services to patients for the hygiene department, and we take care of your dental needs.
So here in the prosthodontic lab at the School of Dentistry, we fabricate most of the appliances that go in for insert for the undergrad students at the school. We, on average, do a little over 400 units of crown and bridge a year, as well as all of the removable partial dentures and complete dentures.
iStock Audio.
We cater to the 3rd and 4th year students and their patients' needs in the undergrad clinic. That's usually around 85 students every year. We also have 4 GPR residents and 2 prosthodontists who work here at the school.
iStock Audio.
I think the thing that I'm most proud of now is that the school has really tried to take steps to keep up with the leading edge of dentistry. We've acquired a lot of CAD/CAM and computer design equipment. We have a couple of mills. We're really stepping into the future with all ceramic crowns. It's quite a departure from when I first started, and I think the school should be really proud that they've decided not to stay status quo, and they've kept up with the industry.
In our program here is that we provide students with more difficult cases. Students will do sometimes impacted teeth, they do tuberosity reductions, they do palatal tori, they'll treat patients for mandibular tori, and they'll sometimes get involved in more complex treatments with the instructor in doing sinus closures and other types of procedures that are related to implants. In today's society, we deal with a much older, much sicker population. And the most important thing before we teach the surgery is that students have to know how to evaluate patients, how to diagnose the problems, and how to treat and plan the patients. In this regard, we book very complex patients in the clinic. One of the most important aspects of what we do in the surgery clinic is that we take care of the patients for the School of Dentistry. We're focused patient care, and the patients, in spite of the fact that we're a learning institution, the patients always come first.
We made the decision to move to the new building here. We went completely digital. We didn't bring any film with us or any processors, so that was really quite a big change, and I think it's a change that's been very much for the better. We don't miss film at all, and we're very much enjoying using our digital technology. So we have both a mix of direct digital sensors and PSP plates, and we're glad we've got both because some patients can't tolerate the direct sensor, and then we can use the plate. So as I said, we use a mix of both direct sensors, 2 sizes, a size 1 and a 2, and then when patients can't tolerate the direct sensors, which give you the instant image, we use these little PSP plates, which are very similar to the old film, but and they're nice and thin and easy to position, but these don't give you the instant image. These still need to be fed through an actual scanner to get the image.
We get soiled instruments from all the units like oral surgery, ortho, main clinic, GPR, radiology. All the cards come in the decontamination area from all these units by the porter, and they sort all the soiled instruments, and then it is either manually washed or it is going through the washer disinfector, and after that it comes to a clean side, and it is again getting sorted to the individual items or the main workstations where they build the instruments. They scan all the cassettes and the small instruments to the computer, and then we have 3 sterilizers, steam sterilizers. Then it goes in the sterilizer. After that, once the cycle is completed, it is sitting outside the sterilizer to cool off.
The research in dentistry actually over the last couple of years has changed quite a bit. Now the way the research has changed is that in dentistry, which for a long time used to be very descriptive, now has embraced a lot of molecular techniques and biological techniques, stem cell biology, and really has embarked on big research programs in many different countries. With our research, what we try to do is to understand basic mechanisms on how these tissues develop and how these particular molecules, these BMPs, are involved in the formation of these tissues. And we believe by understanding the involvement of these molecules, we can get a better grasp on how we can actually use these molecules for clinical purposes in treatment of patients that actually carry such defects.
The dental hygiene program at the University of Alberta is an excellent program, and the graduates coming out of this program are very well recognized across Canada, probably really recognized as coming from one of the best programs of dental hygiene in the whole country. I'm presently standing in our simulation lab, which is an excellent facility. We're extremely lucky to have it. One example of one of the reasons why our program here has been so successful, and we're very lucky just to have the technology that we have in here. We have the ability to project things on multiple screens across the rooms. We have document cameras. We have a simulator at the front where we can perform procedures, and then the students can perform them at their own chairs. Our program is the standard in Alberta.